How are you today?
I'm a little nervous.
Well, that's a natural way to feel before surgery.
You will be asked to change into a gown. The peri-anesthesia nurse will ask you a few questions to verify information about your medical history and medications. Your nurse will confirm that you have not had any food or drink in the hours before surgery. You may also be asked to remove your jewelry, including any piercings. The peri-anesthesia nurse will then take your blood pressure, pulse rate, and temperature.
And do you smoke cigarettes?
No, never have.
Excellent. You know that
The anesthesiologist will completely review your medical records and will ask you many of the questions you have already answered.
I'm going to take a listen to your heart and lungs.
Your anesthesiologist will listen to your heart and lungs and do a brief physical examination.
For this type of surgery, let me tell you a little bit about your anesthesia that you will have.
Okay.
First of all,
The doctor will also discuss with you the type of anesthesia that is recommended for your surgery. There are several factors the anesthesiologist will consider in deciding which type of anesthesia is best for you. These include your age, history of problems with anesthesia for you or your family, any medical conditions or allergies, and the type and length of surgical procedure you will be having. Your anesthesiologist will discuss with you the various risks and benefits of your anesthesia.
Do you have any questions for me?
Well, my sister had a lot of trouble with vomiting when she had her surgery.
Your doctor is trained to address all of your concerns, so don't be embarrassed or afraid to ask any questions or express any concerns.
What about the pain? Will I have much?
Two of the main concerns people have are whether they will have pain and will they be sick to their stomachs following surgery. One of the main purposes of anesthesia is to help you remain as pain-free and comfortable as possible during and after surgery. If you had a problem with post-surgical nausea in the past, tell the anesthesiologist. As part of your preoperative instructions, you may be taught to describe your level of pain following surgery on a scale of 0 to 10. In the post-anesthesia care unit, commonly known as the PACU, the peri-anesthesia nurse will assess your pain on this scale and will adjust your medication until you are comfortable and relaxed. Some patients who need to remain in the hospital following surgery may be offered other ways to manage their pain. One of these methods is called PCA, or patient-controlled analgesia. This is an entirely safe method of pain relief, which allows you to deliver medication by pushing a button. The other way is when pain medications are administered with a spinal anesthetic or through an epidural catheter. Your anesthesiologist will also prescribe medications during or after your surgery if needed to reduce the chance of nausea. Before you go into the operating room, an intravenous line or IV line will be started. The IV will allow the doctor to give you fluids and some relaxation medication. It will also allow the doctor to control the amount of fluids given during surgery and provide a ready way to give other medications.
okay, Mrs. Aronson, it's time to go to the operating room now.
Our concern for your safety and comfort follows you into the operating room.
I'm going to start off putting our monitors on.
When it's time for your procedure to begin, the anesthesiologist may ask you to breathe oxygen through a mask, and then will give you medications through the IV line to help you go to sleep. After you are completely asleep and unaware, the anesthesiologist might need to place a soft tube into your throat and windpipe to assist your breathing. This is called intubation and allows the doctor to control your breathing during surgery. Some patients notice scratchiness in their throat after the tube is removed. This is entirely normal and will last only a short time. During anesthesia, there are many vital functions that will be closely monitored. The oxygen level in your blood, your breathing patterns and carbon dioxide in your breath, your heart rate and changes in your electrocardiogram, and your blood pressure. These monitors allow for immediate detection of any problems. The continual improvements of anesthesia delivery and monitoring, combined with the doctor's skill in using these instruments, has contributed greatly to patient comfort and the remarkable safety of anesthesia today. After surgery, the breathing tube will be removed and you will be taken to the PACU. This phase of intense observation may last from minutes to hours depending on each patient's needs.
How are her vital signs?
O2 sat is 98.
Your anesthesiologist will inform the peri-anesthesia nurse of your condition, and the nurse will monitor your post-anesthesia recovery to assure the stability of your vital signs and to treat your pain. If you do have pain or nausea, medications will be given to make you feel better.
Mrs. Aronson, we're going to take you to...
If you need to stay in the hospital following surgery, you will be transferred to your room when you have recovered from your anesthetic. If you are going home the same day, your anesthesiologist will discharge you to the outpatient unit. Here, a nurse will continue to monitor your recovery.
Can I offer you some more apple juice?
Sure.
You must be completely alert and, in some cases, able to drink fluids and pass urine before going home. Before you leave, the nurse will give you some instructions for your rest and care at home and answer any questions you may have. It is important that a responsible adult be with you when you go home. This means you cannot drive a car until your doctor says you can. When you get home, a peri-anesthesia nurse may call within a day or two to check on how you are doing. We hope this video has helped answer many of your questions about anesthesia. Like all medical procedures, anesthesia has risks and benefits. Please be assured that all of your doctors and nurses are dedicated to your safety and comfort. Be sure to ask them all the questions you may still have. Answering your questions is an important part of what they do. Thank you for watching.
Anesthesia and You is presented in cooperation with the American Society of Anesthesiologists, the American Society of Peri-Anesthesia Nurses, the Anesthesia Patient Safety Foundation, and is made possible through an educational grant from Baxter Healthcare.